Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Balancing Personal, Professional, and Caregiving Roles, sponsored by Prince George's County Government and the Department of Family Services.
Good evening, everyone. Thank you for joining us tonight and for balancing personal, professional, and caregiving roles. To get started, I'd like to introduce myself. My name is Glenda Willis. I'm a licensed clinical professional counselor. I have been a licensed counselor now for over 30 years. I retired from the school system last year, and I've been doing various workshops and other things for the city of Greenbelt. Just some housekeeping things. If everybody could put their mics on mute. And also, if you have any questions, if you would put them in the chat box, and then we will take questions at the end. So to get started, we'll start with the breath. That's always a good place to start. And the breath is very important to how we can learn how to calm ourselves, how we can focus, relaxation, to center ourselves, and to get ourselves on point for being aware and accepting the different things that are going on in our life. So to get started, I would like to bring our attention to tonight and maybe get a chance to relax a little bit from the day that we had. And I'm going to open up with a breathing exercise. And this is my breath ball. Can everybody see that? And what we're going to do is we're going to just breathe for a couple of minutes. We're going to, when I open the ball, we're going to take an inhalation. And when I close it, we're going to exhale. And while we're doing that and concentrating on the breath, I want you to think about your lungs. Picture your lungs. Picture your lungs having three sections, a bottom, a middle, and a top. So as we're breathing, inhaling, we're going to try to fill up from the bottom to the middle to the top. So if you follow me, we're going to inhale. Exhale. Inhale. Exhale. One more time. Inhale. See how you can expand, how wide you can expand. Hold for a little bit. And exhale. Thank you very much. And we'll get started. So the definition of balance is the even distribution of weight, enabling someone to remain upright and steady. And to do that, we're going to look at different things that help us keep and create our balance. Acceptance, awareness, healthy boundaries, picking priorities, trying to be organized, routines with flexibility, schedules with flexibility, and practice. Tonight, we're going to talk about personal, professional, and caregiving balance. And I chose to do personal first because that kind of takes in every aspect. People will kind of work off our energy and everything that we're doing, as well as us working off of our energy. So the first thing we need to think about is acceptance, which is said to be the action of undertaking something without attempting to change it. It includes being tolerant and being judgmental. Basically, what we're saying to self is, it is what it is, so I'm going to deal with it. Like, for instance, we could say to ourselves tonight, I have multiple roles to play in my life at this moment. And then awareness. Awareness is said to be a state of being, consciousness of, or having the knowledge or understanding of. Being aware is a process. And like, for instance, if we were to think, we do some self-awareness, we could say, how do I process information best? What is my learning style? Am I a visual learner? Am I an auditory learner? Or am I kinesthetic learner? Meaning, do I learn best by seeing something? Do I learn best by hearing it? Or do I learn best by manipulating it? Or am I a combination of? Also, for instance, sometimes you can think about how you eat your food is also how you can process or your relationship to the world. Do I like my food on my plate separated and I eat it separately, one portion at a time? Or do I mix it up and eat it all together? Self-evaluation can also take us to being, what do I value? What are my wants and needs? What are my triggers? Like, what takes me to a place or triggers me to make certain decisions? Where is my locus of control rooted? Is it internal or is it external? Knowing these things help us make decisions in life and also help us control different situations when we know how we work with them. Being other aware is important as well. How others in my relationship process their information. What changes have been caused by the illness they may be dealing with. What are their triggers? How can I best cooperate, or how can we cooperate with each other to make sure everybody's needs are being met is an important aspect as well. Being aware can help us set healthy boundaries, knowing our limits, when to ask for time or ask for assistance, setting our priorities. It's going to be important to set schedules as we try to balance the components in our life, and organizing ourselves so we don't feel like we're overwhelmed. And this takes practice. And in doing that, we need to also make sure we're doing it with flexibility. We don't want to do it rigidly because that can start stress. And stress can lead to other factors that spill over into other factors in our life. So being able to be flexible is going to be key in balancing. You don't want to say, if I don't get this done by 2 o'clock on Tuesday, and then I'll have a meltdown. Also, assessing and analyzing situations, being focused and intentional on what you're planning is also done through awareness. Developing a self-care plan, building positive experience, and creating the space in our life, internally and externally, to accomplish our goals, not only personally, but professionally and as a caregiver. Resilience is something else that's as also important as we move through this process. And it's said that resilience is the ability to absorb, adapt, and recover without too much suffering. Resilience assists us in making connections that can protect us from and help us not view crises as unresolvable challenges, but maybe review them as opportunities to learn. Also, resilience can help us accept change. And as we deal with our loved ones as they go through the illness and the changes that they go through, it helps us take action and it helps us find ways that we can cope, helps us keep things in the proper perspective and context, as well as to maintain healthy and a helpful outlook as we go through life and its process. Next, mindfulness. Mindfulness is maintaining a moment by moment awareness of our thoughts, our feelings, our body sensations, and the surrounding environment, hopefully through a gentle and nurturing lens, the five senses. Some of the gurus in mindfulness have other definitions. For instance, John Kabat-Zinn says mindfulness is paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Jack Cornfield says mindfulness is attention. It is non-judgmental, receptive awareness, respectful awareness. David Siegel says mindfulness is characterized by non-reactivity, observing, noticing, acting with awareness rather than automatically concentration and non-judgmental attitude. So everybody that was talking about mindfulness wanted to know and wanted everybody to know that it's non-judgmental. There are said to be three states of mind in DBT counseling skills, and they are the wise mind, the rational mind, and the emotional mind. The reasonable mind is our traditional thinking state of mind. It's our practical and our pragmatic, logical, and rational, task and rule oriented way of thinking grounded in facts and reasons. Emotional mind is the opposite of reasonable mind. Emotion mind isn't necessarily unreasonable, but it is not reasonable in the sense that it doesn't rely on reason. It's not concerned with facts or logic. When we're in emotion mind, we're governed by our moods, our emotions, how we're feeling, and we act or base the urges that arise from our emotional state rather than based on any sort of thought or plan. Being aware helps us find out what mind we're in. Now, the wise mind is the synthesis of the reasonable mind and the emotional mind. It's where these two states of mind overlap. It takes into account both the rational and emotional, or logic in our feelings. It's practical and sensitive to how we feel. It lets us see the whole picture and think and act in ways that are reasonable while remaining true to ourselves and our nature. Being mindful helps us figure out what mind we're operating from. Mindfulness also assists us in being present, paying attention, focusing, or minding our minds. Being mindful assists us in setting our intentions and again, priorities, schedules, and goals. Being mindful helps us be where we are, helps us think about being instead of always thinking about doing. Something else that helps us keep ourselves personally balanced would be self-care. Practicing self-care helps us continue to do what we have to do. Through self-care, we can build positive, healthy experiences that create the energy and motivation we need to cope through life's experience. Self-care helps us in replenishing our well so we can share with others and others can benefit from our sharing. Now, self-care can include many different self-soothing activities, relaxing activities, or even energizing activities. Examples being maybe a bubble bath, a shower, aromatherapy. Lavender is a great scent for calming and relaxing at the end of the day. Meditation, exercise, yoga, tai chi, qigong, aerobics, jogging or walking, lifting weights, going to the gym, all fall in the realm of self-care. Self-care can include sleeping as well as eating and having proper nutrition. It's not always what you eat, it can be how you eat and also when you eat. Self-care can mean scheduling breaks, knowing when it's time to take a break, to reset and recharge. Self-care can include journaling. Journaling is something that can help us unload the mind. If we're feeling overwhelmed, we can get it out of our head and sort of kind of put it on paper. We can have a journal that is maybe an attitude of gratitude journal, which helps us look at the things that are going right in our life, what we're grateful for, and not the things that may not be going right at the time. If we concentrate on the things that aren't going right, sometimes they seem to take us over. That's where our energy goes, and then they start to grow. So it can help us unload our minds. Self-care also includes saying no, knowing your limits, setting healthy boundaries on how we relate with the people in our lives in the world. So I chose just to pull out a little bit of from the self-care and highlight them a little bit. So talking in reference to meditation. Meditation is a practice of quieting the brain. There are several forms and ways to meditate. Prayer is meditation. Autogenic training is meditation. Autogenic training uses a script that you repeat to yourself. And then you go through the process of repeating this and meditating on the script. There's transcendental meditation, sometimes called TM, and transcendental meditation uses a mantra, which is sometimes a word or a small phrase, maybe 2 words that you say over and over again to quiet the brain. And then, of course, mindfulness, which concentrates on the breath and using the breath to help us go from one relaxing moment to the other. It's thoughts appear in meditation and mindfulness. You just don't hang on to them. You let them go and go back to your breath. Sleep is a very important aspect of balancing ourselves. It is often said that sleep has healing powers. Assessing our sleep patterns can help us get better sleep. Sometimes people are bothered by insomnia. Can you go to sleep? Do you get to sleep right when you lay down? Or does it take you a while to fall asleep? After falling asleep, do you wake up several times during the night and have trouble returning to sleep? Is one of the reasons you can't go to sleep is because your mind keeps racing and you keep thinking and it's troubling your sleep. Some research points out the things to do or not do to get a good night's sleep. And of course, everybody's different. So it's not always the same reason that we can't sleep. And some of these things won't work for everybody. Like they're saying, having a bedtime routine sometimes can get us in the mood to have a good night's sleep. Trying to go to bed at the same time nightly. Also, in that may be waking up at the same time in the morning. Making your bedroom dark and quiet, free from electronics. So that means like maybe not having a television in the bedroom or not having your phone on in the bedroom. Also, they say avoid alcohol 5 hours before going to bed because it can cause nighttime awakenings. Avoid caffeine drinks before you go to bed. That says that sometimes caffeine drinks can cause shallow sleep or nighttime awakenings. Breathing exercises can help you relax to maybe help guide you into a peaceful sleep. Nutrition. Eating habits were included also in self-care. And it's not only what you eat, but how you eat. Do you take time to enjoy your meals or do we rush through them? Certain research says that we eat incorrectly here in America. They say that we don't digest our food properly. Some of the reasons they have for that is they say you should eat a carbohydrate with the vegetable, but not with the meat protein. You should eat the meat protein with the vegetable, but not the carbohydrate, because the protein in the meat may make it hard on your digestive system. It's also been said that you should eat prior to 7 p.m. at night. You shouldn't go to bed on a full stomach. You should eat your heaviest meal in the morning and then eat lighter as it goes on the day. So they're saying you should eat heavy in the morning, maybe medium at the midday, but for dinner, like a pauper. As we move to the professional balancing, to create the professional balance or work life and caregiving, it's an important part of lessening stress. You may need to have a schedule to meet with your employee, schedule a meeting. You want to discuss your needs, maybe see what options or support may be available to you in the caregiving process. Ask yourself certain questions so you get there, you will be able to talk to your employer about what you need. Know the rights that can protect you as a working caregiver. The Family Medical Leave Act, American Disabilities Act, Title VII. AARP is a great resource for certain information like this too. that it can help you maneuver through this process. Working from home. Now, sometimes that may be something you want to do. I know now where a lot of us are doing it because of COVID. But even if there wasn't COVID and you chose to work from home sometime to assist your loved one in what they're doing, have a designated workspace. You want to be able to go to that space, and when you finish working, leave your work there until you return the next scheduled time for work. Have specific times to start and end your workday. Take breaks, maybe during the day, especially to eat. And try to keep your meals at normal times as possible. Let your colleagues know about your role as a family caregiver. Be proactive with your schedule and have contingency plans in place. There are times maybe that you need to make certain appointments, or sometimes we're called the sandwich generation because we're dealing with our older loved ones, but then we also have families, so we may have younger loved ones, and we may need to balance their schedules with our schedules because there's things that they may need us to do and to help them pursue. Know your limits. Do you need extra help to maintain balance? Look for available resources. Have lists made of available resources. Seeing what resources are there. Sometimes if your loved one is living with you and not in their own space, you may need to look into respite help. So asking for help when you need it is very important. This will prevent burnout and help you move through your professional existence with better balance. Balancing the caregiving needs. So providing care can be especially difficult. It can be both physically and mentally exhausting. So some of the things that we may need to think about in being proactive is to create a needs assessment. Not only a needs assessment for yourself, because you do need to know what your needs are in order to set healthy boundaries. But you may also need to get a needs assessment of the person in your care. You may need to know what you may have to do to help them through that process. Take time to learn about the symptoms that come with the condition the person you're caring for brings with it. In some cases, it could be memory loss. What does that mean? How do you communicate with that person? Being patient, talking slower. How is the processing time? What do you need to do to make sure that the communication process is both two ways? The person also is probably having frustration. Sometimes there are behavioral concerns. Being able to figure out how to handle these behavioral concerns is important. There may be safety concerns, the need for daily living aids. That can come from looking at the needs assessment as well. Also checking to see how to help the person may be in need of just daily living habits, hygiene. Being mindful in this process is important as well. How do I help my loved one maneuver what they have to maneuver as they have to live with what they have been dealt at this time? Ask medical professionals questions about your loved one and the situation that they are having to deal with. Ask them how you can help. What help do you need to give? What plans do you need to put in place to help them as well as yourself make sure you're having the healthiest existence that you possibly can? Assess the environment. What may need to happen in the environment to make sure it's safe and comfortable? For instance, if you're caring for someone in their home or if you're caring for them in their house, are there clear pathways for them to move through without harming themselves? Also, nutrition is going to be important for them. As in the aging process, there are certain things that we need to stay healthy as we can. What is it that they need to have a balanced diet? Try to keep social connections in contact as much as you can. Social isolation is a problem for people as they are aging and dealing with certain physical limitations and illnesses. It also can be a problem for us as caregivers because if we feel socially disconnected, it's not allowing us to feel that we have that balance. Research now has it that a lot of people, because we're dealing with the virus, are feeling very socially isolated, and it's causing a rise in anxiety for a lot of people and how they can deal with each other. So think about how you can keep social connections intact. Maybe you can Zoom, or maybe you can have them Zoom with friends or relatives that will help them feel that they're still connected as they go on the journey. Be observant. Sometimes we don't always need to be doing. Sometimes we need to step back to gain awareness as to how to maneuver best. Caregiving also has to do a lot with knowing our triggers, but also knowing the triggers of the people that we are caring for and how to assist them in dealing with the things that may trigger them. I am having a hard time. I'm going to turn off my video for a minute. And I do apologize, but my computer seems to have frozen.
And thank you to the audience for your patience as we move
Yes,
through
I do appreciate it.
difficulty. Glenda, I think you can hit escape on your keyboard.
Okay, thank you. Thank
There.
you, Catherine. I appreciate you so, so much. I need to breathe. So you, as we go through, you want to be observant as to how the needs of the person that is in your care, how you can help them, and how you can meet those needs in a way that is both helpful to you and helpful to them. One thing that's going to be very important is being patient with yourself and being patient with the loved one that is there for you and with you. As we look at things in some summary, we want to think about not only physical health, but emotional health. We want to think about how important is relationships in the case of how we process information and how our loved ones process information. We want to feel about how we can do things, stay in the present, and avoid the pitfalls that may come and arise in our life. So in closing, I want to go back to the breath. I want to make you aware of some resources before we go to the breath. Some resources that can help you as far as maintaining balance and also doing different meditations and listening to different talks that can help you go through what you may be experiencing when you feel like you're tipping one way or the other is looking on YouTube. They have many different videos that talk about guided meditation and mindfulness. There are TED Talks that talk about caregiving. And sometimes you may need to seek the help of a professional as far as to retaining your balance. When I look at seeking the help of a professional, a counselor, I don't look at it as saying something is wrong with me. I see counseling as just a way to help get centering and balancing back because circumstances and situation in life sometimes throw us off our balance. We find ourselves maybe we're tipping to the front or the back, we're leaning right or left. And in order to come back to center, sometimes we need to talk to someone to help us get back to center. And that's not that that person is going to tell us what or how to do things, but there's someone that can listen without judgment, someone that can listen objectively. When talking with my clients, I tell them I am a passenger on the bus. You are actually driving the bus. I'm here to help you put in place what you would like to put in place. So sometimes it's no shame in asking for assistance when needed. Also, the last thing I want to talk about is basically thoughts. A lot of times it's not the situation that we're in, but the thoughts that we have about the situation that can throw us off balance. So sometimes it has a lot to do with what we say to ourselves. How are we creating different thought patterns? Are we saying things that kind of rob us of positive energy? Or do we say things to ourselves that are uplifting and helping us move on? The brain is very capable of having many, many thoughts that just keep going and going and going. And it's easy for us to get overwhelmed with competing thoughts. So taking the time to try to quiet the brain, ease the brain, so it's not having all of these competing thoughts that overwhelm us is important. I just like to take a few minutes to go back to the breath. And this time, the practice, we're going to do a little different practice. I would like you to take your right hand and put it on your lower abdomen, and your left hand and put it on your upper chest. This breath exercise is called conscious breathing. And after we do it, I'll let you talk to you about why sometimes this is good to breathe this way. If you decide that you want to use this, you'll get used to doing it and you won't have to put your hands in those places. The reason I asked you to do that this evening is because I want you to experience the bottom hand moving when you take an inhale, and the top hand should very rarely move unless you're feeling all the way up. It may move slightly. The hand that's going to move most is the hand that's on your abdomen. So when you take a breath in, it's going to be like filling up a balloon. You're going to fill up from the bottom up to the top. And so when you take the breath in, your abdomen should expand. So let's try that. Take a breath in on 4 counts. In, hold for 4 counts. When you exhale, that goes back in. Try to push it back to your back. Exhale. Inhale. Hold. Exhale. One more time. Inhale. Hold. It's another reason breath is important, because it can help us in those moments where we get frustrated, in those moments where we feel off balance. We can go to the breath to go within, to find centering, to find calm, to quiet the brain, to stop those thoughts from just running through. And when you're breathing, the thoughts come, you don't hold on to them. you let them come, you let them go, and you go back to the breath. The breath is important because it's there for us. Everybody has it. It's free, doesn't cost anything. I want to thank you so much for having patience as I had all my technical difficulties this evening. I want to thank you for taking time out of your busy schedules to come and be here and share. Namaste.
Well, thank you again, everyone, for joining us tonight. Just a few ending announcements to this great presentation. Again, thank you, Glenda, for taking the time to share this information with everyone. Dementia Friendly America has a few for the Northern County sector, has some information to share. Glenda, if you could just hit next on the slide. We are continuing the memory screening Mondays, the first Monday of each month from 2 p.m. to 4 p.m. To register for that, you can either contact Sharon by calling her, the number is below, or emailing her to set up your appointment. This is a free screening. Again, it takes place the first Monday of each month. We also have virtual support groups that are still going on. We have our caregiver support group the first and third Wednesdays from 6 to 7 p.m. And if you would like to receive more information, you could also join our monthly email newsletter. This includes upcoming virtual events, resources, and updates of activities and projects that we are working on. We also have our own Dementia Friendly America Northern Prince George's County YouTube channel. You can find past YouTube videos on being a dementia friend, caregiving, and other related information on our YouTube channel. Again, this is a free resource. And Glenda, if you could hit the next button again. You can also find information. Prince George's County has the Area Agency on Aging. You can call them. They have community programs that are set up. You can search this by looking for your local area agency on aging. There is a website, eldercare.gov. You can also visit the National Institutes of Health for more clinical information, to learn more about your loved one's diagnosis. They also have the National Institute on Aging. And also, if you'd like to know more about any clinical trials that are active and ongoing, at clinicaltrials.gov. And then if you have any more questions about aging, how to stay active, prevention, you can visit the cdc.gov websites below. The presentation that you just have seen will be uploaded, available for you to watch on our YouTube channel. And there is also a handout that is attached. So if you would like to share with someone else, or if you would like to go over the information that Glenda has presented today, you can do so. Again, thank you everyone for joining us. Have a great night, and we hope to see you at the next event, virtual event soon.